Welcome to this new episode of the Leaders of PLS podcast. I have the absolute honor, the pleasure of having with me Dr. Anderson Chuck, who just asked me to refer to him as Andy. Andy, good morning.
Good morning.
Thank you for being with us.
Oh, ça fait un plaisir.
C'est un plaisir pour moi aussi. Andy, you are President and Chief Executive Officer at the Canadian Institute for Health Information, which is known as CIHI.
Yes.
Right? You've more than 20 years of experience leading large-scale initiatives that leverage data to develop actionable strategies and improve health systems. That's big. You look young. We already talked about it. Beyond the numbers and data, what would you say personally connects you to the work of improving healthcare systems? How do you ensure the human is, centered in everything that you do?
Oh, for me, that's quite easy. Because at the end of the day, it's really about patients and families, right? I'm a patient. I've been a patient. We have loved ones, that's someone's brother, someone's son, someone's mother, someone's sister, someone's aunt. It really is about loved ones. And if you've ever seen a loved one sick, then you know what it's about. You know what the stakes are. And so when you think about it that way, it's all about them. And so that's how I think, for myself, I have that always front of mind. And at CIHI, we're here to serve and improve health for Canadians, for patients, for loved ones.
Now, how do you do that, mainly? Like, tell me about on a daily basis.
Yeah, so, I come from the health system. I used to work in a health authority. And the reality with data is that health systems are already drowning in data. What they're thirsty for is information. What's the kind of information that's going to result in the kind of insights that can then be used to change the system for the better? At CIHI, we know that there are opportunities to improve health data, but there's also the fundamental responsibility to be able to tell the story and to connect the dots so that we can have the understanding of the health system that then leads to the kind of changes that benefits patients, families, for all Canadians.
So it's about the patients, it's also about improving the system.
Absolutely.
How can data now help us solve or at least improve some of the current issues? And we're not going to talk about issues, we want to talk about solutions, but how do you see your role at CIHI for current problems, issues like overloaded doctors right now or management issues?
We know that data is the fuel, right, that drives health systems. But as I mentioned before, right, it's about being able to provide the information, right? Because data itself or the system's drowning in the amount of data that's out there. And so So at CIHI, what we're working towards is really being able to connect the information in a way that provides the necessary insight and the deeper understanding of the health system so that the levers for change to make a difference is easier to see, it's easier to find. Even if as simple as something as going onto our website or finding a CIHI report, right? Like making that easier so that information is not hard to get. And at CIHI, we're trying to find the beauty in simplicity because it's in that simplicity and that connectedness of the information that we believe will make the difference for people to actually use and action the information to better the system.
And is it hard? Would you say it's hard to implement such, new things like that? Is the change hard, or to implement new initiatives like that?
I think that it requires intentionality.
Yep.
Right. It really at the conference here, I heard that the Quebec narrative that they refer to the health system. Did I get this right? Because I'm not a French speaker. A
Yeah.
mammoth. It's the mammoth.
That's the word we use.
That's
yes.
the word we use, right? So it really is the size of the issues that we're doing, the size of the system. They're big, right? And so we have to make it easier, right? We need to make it accessible.
Yes.
We need to get the data connected. We need to have comprehensiveness in the information we have, not just hospitals, but primary care and continuing care. And then we need to bring that all together. That's what we're working towards in CIHI, bringing it together, but then also delivering it in a way that's simple to access, to use, to analyze, to interpret, to then result in the action and the change necessary, right, to improve the health systems and the delivery of care that then improves the lives of patients, families, and Canadians.
And this is what an event like PLS does as well, connecting people,
Absolutely.
bringing them to share ideas.
Yes.
And yeah, so
Yes. And I think you bring a really important point that there's the human side to the delivery of health.
Yeah.
Right? That's why when you first asked me about what grounds me, right? It's nothing is, at least to me,
Yeah.
nothing is more important than loved ones and family. The humanity
the
and
human
the human
experience of it
experience
all.
around
yeah.
of it all, right? That is what we're trying. If CIHI ultimately, if we're going to deliver on a mission of better data, better decisions, healthier Canadians, it's about how do we make it such that we are improving and actually having an impact, a positive influence in the everyday lives of Canadians, right? That's really the ultimate goal we're trying to get to, right? And the way we hope to do that again is from what I said. Can we be the storytellers? Because we have all this data that now needs to be information, right? Can we be the storytellers to describe what is really happening, to then give the insight again, right?
Yeah,
The understanding.
absolutely.
So,
and first
anyway.
line in health is about everyday care.
Yeah.
Tell us about your most recent success at CIHI. I think there are a lot of things going on and very good things happening.
Oh man.
Is there anything that you would like to talk about?
I am so humbled and proud of the work that we're doing at CIHI, and I believe we are making significant strides in addressing the big, not the small issues that are facing health jurisdictions across the country, but the big ones, right? Like workforce issues, better data in mental health, addressing data gaps, ensuring data is connected through the work we're doing on interoperability, the things that we're doing in standards to ensure that the information in connectivity is also of high quality. So all these things are areas where I'm proud to say, but if I could say, the thing that I'm actually most proud of and happy is when I get to speak to the various users and people out there, stakeholders across the country that depend and use CIHI data, when they say to me, you know, we needed CIHI to do this. If it wasn't for CIHI, as an example, we have information now on homelessness. And someone said to me, you know, before having that information out there, we didn't know what was going on.
Well, that's the thing. That's
right?
the thing.
And so it's those kinds of things when I hear it from people directly around how we are making either their work better or the system better, that to me signals that we are actually making a difference
Progress,
and having an
big
impact.
changes.
Yes, when I hear it directly from the people in the mammoth or that's
In the field that's
Yes,
related
right.
to, yeah.
Right.
And is it data helping us identify places where we can improve services so that we can actually spend more time with the patient, the human being, and less time on admin stuff? Or like, is it something that you
Yes.
also do?
Yes, but I want to say that we also recognize that the production and the gathering of information in the health system, like we rely on the system to be able to collect the information. And at CIHI, we are also working on easing the administrative burden
Awesome.
of collecting that information
Yes.
too, because we
Yes.
know we have a role in making the frontline lives easier, right? So I think that's also an important thing. But absolutely to your question, right, about are we working, how are we working to improve?
Yep.
That's literally what it's about, right? The reason why we exist is to serve. It's to make a difference in the lives of patients and families out there across the country.
Thank you, Andy. So this was the easy part.
Okay.
Now we're gonna jump.
Okay.
No. Don't
Okay.
worry. Into some rapid fire questions, just
Sure.
to get to know you better.
Sure.
Get into the more
Okay.
personal,
Okay.
not too personal stuff.
Yeah.
Okay.
Ask me any question you want.
So, okay, don't say that twice. When you need to think or focus, would you go on a walk in nature, or would you go to a BC coffee shop, for example?
Oh.
What is your
walk
go-to?
Walk in nature,
Yeah?
for sure. Absolutely. Yeah, I'm a walker.
Do you do that often? Do you?
I do.
Okay.
I do. Yeah, I try to walk. I try to walk as much as I can.
Relax your brain a little bit.
Yeah, just to be able to have that sort of like ability to get out there in the environment, into nature, and be able to
Connect.
reflect and think.
Coffee or tea?
Tea.
Tea. Oh, really?
Yeah.
In the morning?
Yes.
Okay. Let's talk about morning routine essential.
Sure.
Exercise or quiet time?
Quiet time
Okay. What's your tea?
with the tea. Yes. I'm a bit of a
Ouch.
geek, so if you're into Star Trek, you'll know that Jean-Luc Picard of the USS Enterprise, what he had for breakfast was always Earl Grey hot.
Am I supposed to know that?
I don't know, but maybe some
Okay,
of the viewers
I'm
know.
so sorry.
Yeah.
I know about Star Trek,
Yeah.
but not the other stuff.
Sure.
Okay.
Yeah.
So routine person.
Tea.
okay.
I'm tea.
Cats or dogs?
Oh, dogs.
It's a good thing because we have the
Yeah.
little puppies here at the at the event. Your favorite type of music would be
Oh, that's so hard.
anything recently? Do you have like a song that comes?
1990s, 2000s R&B in hip
That's
hop.
not recent, but that's good.
But that's what
That's
I
a
still
good
listen
answer.
to. That's what I
Yeah.
still listen to.
I love that.
Yeah.
This is like my teenage years.
Yeah.
Something
See,
like
so
that.
I'm old, right? You know how old I am now. So that's my generation.
Okay,
Yeah.
awesome. I love it. Last question.
Mhm.
Did you have a mentor or a role model growing up?
I'm very lucky to say that my father has always been my hero. But throughout my career, I've had so many mentors.
Do you find it like did it change anything to you? Did it help you? Did it
My my connection with sort of the human side of things comes from my dad. The sort of trying to the value set, the trying to contribute to the world,
to serve like you said earlier?
comes from my
yeah.
father. Yes.
Awesome. Thank you so much, Andy. It was awesome
Merci.
to get
Thank
to
you.
know you a little better.
Oh, wonderful.
Thank you so
Pleasure
much.
to be here.